In this video lecture, I'm going to talk about reproductive system immunology. And as you know that the main function of the immune system in the reproductive system is to defend against pathogens and microbes within the male and female genital or reproductive system. So also one of the main function is maintenance of immune tolerance to sperms and fetus. And as you know that the fetus is possessing allogenic part from the fathers. To achieve that, within the male and female reproductive tracts, there are some innate barriers. For example, mucous membrane, cilia, and acidic secretions. And as you know that acidic secretions protect the male and female reproductive system from microbes. So now I'm going to talk about repeated pregnancy loss. And as you know that the repeated pregnancy loss will be suspected immunologically. Repeated means more, 3 or more consecutive miscarriages, 3 or more consecutive miscarriages. So immunologically mediated loss of pregnancies result from impairment of blood supply to the pregnancy. And the stimuli that lead to this impairment of blood supply to the pregnancy include cytokines and antiphospholipids. So during pregnancy, as you may know that during pregnancy there is a physiological shift from T helper 1 response to T helper 2 response. And that because T helper 1 cytokines are inflammatory cytokines, while T helper 2 cytokines are non-inflammatory cytokines. And in this context, patients with rheumatoid arthritis, when they get pregnant, they get benefit due to shift, as rheumatoid arthritis in some instances it is due to cellular immune response and T helper 1. So shift from T helper 1 to T helper 2 may help these ladies during pregnancy. However, in case of systemic lupus erythematosus, as you know, this is an autoimmune disorder, and these ladies usually affect middle-aged females during the childbearing period. And these ladies, they have a lot of antibodies, actually mostly anti-nuclear antibodies. So during pregnancy, and due to shift from T helper 1 to T helper 2, the antibodies will increase. And so this may exacerbate the disease in these ladies. So the most important question is that if a patient get pregnant and with an SLE patient get pregnant, so will the baby have lupus? Well, and as you know that it is not necessary that all babies they get lupus, and that because some percentage of ladies with lupus, around 33% of these, they have antibodies that interfere with placental function, and these antibodies are called antiphospholipid antibodies, the lupus anticoagulant or anticardiolipin. These antibodies may cause blood clot in placenta, so women who get pregnant 5 to 6 months of remission are less likely to experience lupus flare. So we advise actually for all ladies with SLE to control the condition for at least 6 months before they get conceived. So will the baby have lupus? About 10% actually of women with SLE, they may have antibodies known as anti-Ro, and these antibodies, of course, as you know, the placental transfer of antibodies, usually IgG antibodies, they cross the placenta. So passage of anti-Ro antibodies through placenta to the baby may give a baby with a transient rash and abnormal blood count, and some of these babies may get abnormal heartbeat, and this is known as neonatal lupus, and it is not systemic lupus. So as I mentioned that there is a shift from T helper 1 to T helper 2 during pregnancy. So as I mentioned that ladies with rheumatoid arthritis may get benefit from the pregnancy, but however women with SLE may get some complication. For example, as they have excess antibodies, and these may bind to some antigens and reside in the kidney and may lead to nephritis or lead to formation of the blood clot, as I mentioned, and that may predispose to miscarriage. So now I'm going to talk about placental transfer of IgG, and usually this starts at 12 weeks of gestational age, but most at 32 weeks. However, in a full-term baby, the serum level in the neonate it is equal to that or similar to that in the mother. So now I'm going to talk about very important thing: why the mother does not reject, or how moms tolerate the baby for 9 months without rejection, despite that it has or it possesses some allogenic antigens. And as I mentioned before, that one of the main functions of the female reproductive tract is maintenance of immune tolerance to allogenic antigens of fetus. So, to avoid destruction of fetal tissue by cytotoxic T cells and natural killer cells, these two cells, T cytotoxic and NK cells, usually attacks cells with expressing major histocompatibility class 1. So the T cytotoxic, the target for T cytotoxic is cells expressing allogenic antigens in association with major histocompatibility class 1. But however, in some instances, due to downregulation of major histocompatibility class 1 and the service molecule of major histocompatibility class 1 is decreased. So accordingly, the decrease in the service molecule of major histocompatibility class 1 will be sensed by another cell, which is NK cell, as it has an inhibitory receptor. But however, the cells or the fetal tissue displays a unique type of major histocompatibility class encoded by the gene HLA-G. And it has been shown that cells expressing HLA-G are unable to activate T cytotoxic and natural killer cells. And so now I'm going to talk about the gonadal, or some of the gonadal diseases. And as you know, an autoimmune disorders of this part may predispose to primary amenorrhea or premature menopause. So these two, primary amenorrhea or premature menopause, are often described in women with autoimmune disease and the women that have antibodies against steroid cells. So infertility, I am going to describe it in infertility in men, and actually it is associated with antibodies against sperms, and as you know that sperms are sequestered antigens. They should not be seen by the immune system, and it is similar to the cornea. So cornea and sperms, we call them sequestered antigens, that they should not be seen by the immune system. But however, maybe during surgery or trauma, some sperms may come out and will be seen by the body, and the body will produce antibodies against these sperms, which may predispose to infertility, and also infection. Chronic infections may lead to infertility in men. Thank you very much, Professor Ahmed Bolad.